till this far. Earlier on, I mentioned that today's conversation will be around COVID-19 and the mental health effects it has had on most of us. I know people who lost their jobs. I'm sure it affected them mentally. It affected their health in one way or another. I know people whose relationships didn't work out due to COVID-19, and that impacted their lives either negatively or positively. So not only did COVID-19 bring negative effects, I'm sure there are some positive changes it brought into our lives differently. I have doctors with me on set. I have Dr. Emmanuel and Dr. Geoffrey here to help us go through this conversation, give us some insights, share with us some knowledge. But earlier on, I asked you a question. I posed to you the question of the day, which was, what are some of the things you did to work on your mental health over the COVID-19 period? Share with us the things you did and the changes and the impact that COVID-19 had in your life, either positively or negatively. Our social media platforms are at KUTV Kenya on Facebook, at KUTV_Kenya on Twitter, and at KUTV Kenya on Instagram. Talk to us, let us know what changed in your life. But in the meantime, as I await your feedback, I have Dr. Geoffrey and Dr. Emmanuel. Good morning.
Good morning to you.
How are you feeling this morning?
Fine. Very fine, thank
You're good?
you.
Karibuni sana. I'd like you, Dr. Emmanuel, tell us, who is Dr. Emmanuel? We know you're a doctor, but who is Dr. Emmanuel?
So thank you, Nina. Dr. Emmanuel is a pharmacist, he's a health economist, he's also a union leader for the doctors in Nairobi. And it's a pleasure to be here. COVID vaccination is one of my favorite subjects because we all would like to fight COVID.
Yes.
Probably go back to how life was before. Thank you, Nina.
Dr. Geoffrey, who is Dr. Geoffrey?
Thank you. I'm Dr. Geoffrey Wango. I'm a senior lecturer at the University of Nairobi. I teach counseling psychology. So I'm a counseling psychologist. And I'm glad to talk about not just therapy, but even the effect of COVID. And like you say, it had a positive, of course, effect, and obviously very serious negative effect.
Yes.
And it's good to try to combine them, and also, like Dr. says, it's good to realize that perhaps COVID is here to stay.
Which is a very tough pill to swallow.
Exactly. Yes.
Dr. Emmanuel, you said that you are very passionate about talking about vaccination.
Yes.
What impact has the vaccine brought to us as individuals?
Thank you, Nina. The vaccine, far and above everything, has actually made life go back to some sort of normal. Ideally, a vaccine is supposed to prevent transmission of disease, or what we'd call break the transmission chain. So the vaccines, there was a report about 2 weeks ago which said that it compared countries between December 2020 and December 2021. And it was discovered that just through vaccination, more than 20 million lives had been saved. Of course, there could be shortcomings of this study, but then it just goes on to tell us the importance of vaccination in COVID-19. It can help us, 1, break the chains of transmission, 2, prevent hospitalization. If you're to get COVID, you wouldn't be as sick as you'd otherwise be, and 3, protect the most vulnerable amongst us. Yes, thank you.
Before I get to Dr. Geoffrey,
Yes.
for the layman out there, what exactly is a vaccine?
A vaccine, thank you. A vaccine, not just a COVID vaccine, but a vaccine is an agent or a molecule that is injected into the body. Could be injected, could be taken through the oral route, but ideally its purpose is to boost immunity by eliciting an immune response from your body. So the idea is you get it into the body, and by getting it into the body, it's supposed to mimic what you would otherwise, how your body would otherwise react if you had the disease, and by doing that, evoke an immune response that would protect your body. Yes, against the disease.
Okay.
Yes.
Okay. Dr. Geoffrey, like you said earlier, you are a psychologist.
Yes.
And I'm sure, still in line with the vaccine, I'm sure you saw how people were reluctant towards the vaccine. Why do you think people were reluctant towards the vaccine?
Thank you, Nina. The first thing is that COVID was a new phenomenon. Where did we think ever in our lives that we would be wearing masks?
Yeah.
That we would be struggling with life the way it was. In all our lives, we have never seen schools closed, everything closed. I mean, literally coming to a close.
Sports stopped.
Yeah, and the economy coming to a halt, sort of. So that's why it becomes very difficult for us to come up within our mind to deal with this new phenomenon. You know, from the mind perspective, we as human beings like living what we call normal lives.
Yes.
I like the way he says the vaccine makes us live regular lives. So we sort of know that we wake up in the morning, we do ABCD. But suddenly everything has come to us to a halt, sort of. So when you now tell people that now, even as adults, by the way, we used to receive vaccines, I think, when we were young.
Yes.
So many.
Yes. It's a whole schedule of young people getting vaccines.
When one is young.
Yes.
But not when one is my age. So
then here we are getting vaccines as adults.
And you have to walk to the hospital to get it. And you are like, what exactly am I supposed to do? Do I take it or don't I? And the mind is trying to configure what is best for you. You see, and that's a struggle for many people. But I like the way Dr. is talking, because it's important for us to start asking ourselves backwards. Can we understand why we are taking it? Can we embrace it psychologically? Because you see, the psychological part is this meant for me and for my good? And now you can actually put this now, like you say, for the younger people. They like, for once, they say that vaccine has the vulnerable groups,
yes,
including the aged, like myself, and others subjected to a few what we call in medicine the conditions.
Yes.
But what about young people who can walk in and out, and the COVID takes 3 days and you're back smiling, you're good to go. So and you're telling this person, careful, that they need to be vaccinated.
Why?
So, thank you. That's
why.
Why? Yes. So that's why the young people can't embrace the truth that you're actually telling me I'm all right, but at the same time you're telling me to take a precaution. And you know, remember that in psychology we also look at the young people as risk takers. So you see, if you're a young person, the more you take risks, the more likely
you're here wondering what's the worst that could happen.
What is the worst that can happen? And the worst that can happen is that you can have a cold for 3 days. But Emmanuel here says you need a vaccine.
But after the cold, I will be fine.
But after the cold, you'll be fine. And you see now, so the mindset, sort of, when you now go inside the mindset is like struggling with the two.
Yes. You want to do the right thing, but you also want to do what makes you happy.
And what you're sure of. So that's why now you come back to Dr. Emmanuel and you are like, please assure me that the vaccine is fine, safe, and that it's for my good, and talk to me more.
Yes.
And for me, with due respect, I keep saying, in my view, we should talk more especially to the young people, about why they need to be vaccinated, which is a conversation I'm so happy I've met Emmanuel that we should be having more often.
Yeah, because like Dr. Emmanuel, we would also like to know, if I'm a young person and I take that vaccine, I want children in future, will it affect me? Will it affect my reproductive health? For a man, will it affect his performance in the coming years? I know you've received all these questions, and I'm curious, how do you address these questions?
Okay. Thank you, Nina, and thank you, Dr. Jeffrey. First and foremost, I'd like to say that before vaccines actually get to the level of being administered to anyone, they've undergone rigorous checks. So the current vaccines we have, of course, COVID wasn't expected, and the truth is that the development of the COVID vaccine was not as rigorous as the previous vaccines.
Yes.
However, it was still very rigorous, because by the time they get to being injected in us, they've already undergone laboratory tests, a lot of laboratory tests. They've already undergone a lot of human trials, tested in human beings. Even before being tested in human beings, they actually tested in animals. So the efficacy, what we call efficacy, which is basically how effective yes, a vaccine is, the efficacy is basically assured. May not be 100%, but anything over 2/3, anything over 70%, goes a long way in ensuring that your protection is enabled. For young people, I like how my colleague Geoffrey brings it in. Young people, young people are the most, I would say, the younger generation, which I apparently, as you can say, belong to. We're the most inquisitive, we ask more questions, we're more confident nowadays. It's unlike in the past where we would just be told that you need to do this and we will do it.
You're only here to be seen, not
yes,
to be heard.
So currently our generation, we like to look at it as we want to participate in everything.
Yes.
And what I would assure the young people is, personally I'm a healthcare worker. I was among the very first people to take the vaccine, the AstraZeneca shot. It's safe.
As you tell us that, what were your thoughts being amongst the first people? What were the thoughts you were getting?
Actually, my vaccine journey was very interesting. I probably was among the first 300 people. I took my shot at Mbagathi District Hospital. So it was very interesting because when I got there, I didn't intend to take it on that day. So when I got there, I realized very many senior colleagues were hesitating. Yes, very many senior colleagues were hesitating. So honestly, I ended up taking it out of realizing that, so there's actually no queue. Of course, I understood the benefits of a vaccine, but then mine was taking it from the perspective that there wasn't a queue. But then I understood that vaccines do a lot in breaking the chains of transmission. Vaccines will ensure that if you are hospitalized, if you get COVID, maybe let me debunk this and say, if you are vaccinated, you can still get COVID-19. However, if you are vaccinated and you get COVID-19, your infection is less severe. You are less likely to be admitted or to be hospitalized. And if it's severe, it will be less severe than it would otherwise have been without the vaccine. Another important thing is it protects the vulnerable groups amongst us. I'm a young people, I'm out there, I'm interacting with people, I'm in all these sports events, I'm in these social entertainment joints.
And then I go home to my parents
yes,
in the evening.
Then I go back to
conditions.
my, I go back to my parents who are probably, they're diabetic, they're hypertensive. Some of them are immunocompromised because they're cancer survivors, they're still on cancer medication. So how do I protect them? It is possible that probably with my very good immunity, I could survive COVID. Probably I would even be what we call, I could survive COVID and probably I would even be what we call asymptomatic. I could, as a young person, with all the activity, with all the good immunity, probably with the proper diet then, because as a young person you're there eating fruits, you're healthy. So you find that you're probably very healthy and you're unlikely to even notice you caught the COVID. Yes, you're probably going to be asymptomatic. So how do you protect the other vulnerable groups? If your parents are in the village, maybe they're here in Kiambu, how do you make sure that after spending a whole week in the city, when you go back home, as you interact with them? Because my mom, when I go home, my mom actually hugs me. She hasn't stopped even with COVID. She doesn't think that probably as I have been out there.
You're even a doctor, you're in a hospital all the time.
Yes, all the time. She would actually ask, she calls to ask, how is everything? Are you protecting yourself? But then when I get home, she forgets all that and she would actually like to hug me. So how do I protect her? I protect her by making sure I'm taking the vaccine.
Yes.
So to all young people out there, let's do this. Let's take the vaccine. And it's safe. You brought in a very interesting perspective, which I would actually call, COVID. With COVID, there came what we call infodemic. Infodemic is a deluge of information where you are flooded with information. And especially for younger people these days, this infodemic was perpetrated more by social media and the internet. You go to the internet and you type COVID, you're probably getting over 300 million searches. So through that infodemic, two things came up. So infodemic is basically that deluge of information, that flooding of information, COVID related. So two things came up. There is what we call misinformation, and there is what we call disinformation. Misinformation is basically unintended, wrong information. Disinformation is actually intended, wrong information. Someone could do this to profit, or maybe to just create propaganda. Is what I would call, I used to watch these movies, they're called
fiction.
Not fiction really, but these ones that raises a lot of questions about an issue. I think if I remember, I'll tell you. But then these two things, this infodemic is what caused the two issues you raise. Whether for ladies, does it affect your fertility? So the truth is, so far, there is no proven information that supports the idea that COVID could probably affect a lady's fertility. It's also true for the men. There is no evidence to show that COVID vaccination or COVID vaccine would in any way lower your performance as a man. So I would just like to debunk those two myths that are out there. Yes, the myth and misinformation. Yes.
Dr. Geoffrey.
Yes.
I'm sure you've come across a lot of cases. People have come for therapy during this COVID period. I'm wondering, can you paint for us the image of the mental damage COVID-19 has brought on young people? Would you can you be able to paint that image for us?
Thank you very much. I'm so happy that Dr. has even mentioned the information. Actually, the first thing that happened with COVID is COVID brings in psychologically two words, fear and anxiety. The best thing is that fear and anxiety are related sisters or brothers, as you say, they are twins. Because fear is you fear something that's real. It's a reaction to something that's real. If you see a dog, you fear that. In fact, that's the best example I give him. When you see a dog, you fear it will bite you. The fact is, a dog can bite, but it is not true that the dog will bite.
They bite, but it may not bite me.
It may not bite.
Okay.
Yes, because of two reasons. It may not want to bite you. It may even be caged. But then when you come to anxiety, anxiety is straight, you're moving away from fear. Anxiety is even unimagined fear. So there is the real fear that a dog can bite you. But there are people who are anxious about a dog. There are people who even see a dog.
I am people.
You are part of it.
Yes.
Now when you move into that, you're moving to this other aspect, like he will tell you, called anxiety attacks. There are even people who see a dog and faint, and the dog has not even tried even to bite them, because so you see, the anxiety moves further beyond the fear. Now let's bring in COVID.
COVID, yes.
COVID, unfortunately, COVID has the two. It has the fear and the anxiety. And that's why I like the way Dr. puts it, that about information. And that's what God is basically missing in COVID. The COVID can and does kill. So the fear is real. But then COVID is I like the way he puts the vaccine part. But even if you look at the statistics of COVID, with due respect to COVID is one of the effects scientifically that has had so many recoveries.
Yes,
very interesting. But it is also very fatal.
Yes.
So you see, so the fear and the anxiety are real. In fact, at the height of COVID, I did a paper on fear and anxiety, and that's what made me to do so many talks on TV and on radio, because I kept telling people the difference between the fear and the anxiety. And now, I like the way Dr. puts it. When you bring out the two, you come to fear and anxiety, you actually enter into mental health. Because our health is about our mental health. Before mental health is actually your healthy well-being. Mental health. But people think that mental health is mental health illness. That mental health, in fact, in mental health is about our mental well-being. And actually it encompasses all of our wellness, the physical, the physiological, the social, the moral, the spiritual. You notice I started with the physiological.
Yes.
So that because of that.
Yes.
Because your body must be well for you to go to the moral, the spiritual, the social, the intellectual, the
emotional,
the spiritual, the emotional. Yes. So mental health is about your well-being. So if you make it, for instance, what we had in the month of May, mental health awareness, we are simply talking about your awareness of your mental health. So we can now move straightly from that to illness. And the two are related. Your mental health is actually on a spectrum. If you draw a line, you are mentally well,
yes,
like we are all here. But as you move this way, there is a sickness. So you see, mental health is stress.
It's a very thin line.
Yes, this is yes. But it can also move on a spectrum, because we all have a bit of stress here and there.
Yes.
Price of uga has been up. You want to get some uga.
Yes.
If you, I like making a joke because I'm an Arsenal fan.
Yes.
And you're always being defeated. so everyone laughs at me and says, Daktari, you're still there. I manage somewhere there with a bit of stress. A bit of stress is good for you, but a bit, of course. Even as a
how can I gauge that my stress is a bit?
A bit, yes. It is very simple. It's like, now that I have my book here, it's like this tree. Yes, you can only, you can stretch it, but not too much. This is the part where you remain on this side. Don't stretch it beyond. Don't stretch it beyond. So now, if you move from stress, you see fear of a dog is good. But when you see a dog and you fall down, and the dog is caged, even when you come, they will be like, why did she fall?
Yes.
So this one has anxiety attacks or anxiety disorders. Now, there's some movement this way. So mental health is here, but as you move away, you are moving to illness. So now come bring in COVID. COVID comes at a time when not just we in Kenya, but even we have so many youths, and there was a lot of economic anxiety. So many youths without jobs. So what happens? COVID only came, we became what we call the straw that broke the camel's back. So already people are doing very badly with their relationships. I remember when we started giving talks on COVID, there were several suicides, and I kept saying the suicide will actually double. At one point last year, one of the media called me and said, you actually said the suicides will double, and they have not even doubled. They were actually, in about 6 months, they were at 460 something. Why? Because you see, the anxiety and the stress, it moves. It moves from where you are here this way. Because everyone is stressed. They are trying to cope. And that is what COVID did. COVID suddenly, if you're a young person and you are taking a break with Emmanuel here to have a chat, you're suddenly locked at home. You've not been talking to your wife and you're a man. Well, that's
and all of a sudden you're locked in the house.
I like that. And at one point I remember talking, and some men were calling the lady and saying, I didn't know my children eat 2 loaves of bread. And I was like, you don't know they eat 2 loaves of bread. So you've been calling your wife, but where does the money go to? And you know the children, remember?
You are children.
They could be eating 2 loaves, but remember, they were now home.
So now they could be.
So they can only be eating 4.
They can fall more.
She's even, I like that. Doctor is even adding the milk. Yes, you are right. Yes. If they're taking 2 packets of milk, now it's 4.
Yes.
Obviously, how is your stress? Now
you're stretching. You're now overstretching.
I like that. You're stretching towards the bad part.
Yes.
And that's why comes in. You see, too much stress comes with the other words. Despair, hopelessness, disappointment. If you reach there, if you're moving,
and fear of the unknown as well.
Fear of the unknown. You're moving to depression. Immediately you reach there, you are now moving to mental disorders. You are no longer with us here with our stress levels and hunger. So now you see where COVID comes in.
Yes.
When I put young people here, I don't know which one you would like us to look at. The younger children. Look at the children quickly, fast. Children did not know when they were at home.
Yeah.
They don't know.
They don't.
You can't go to school. Dr. agrees. They don't know. But now I want you to put the group that I really like. The young people, the adolescents, what you call the teens. If you like, they are between 11 and 21. These people don't know why they can't complete secondary school, or why they are not going to university, or why they are not going to college, or why they can't complete. So the tension is so much. And you just said, Dr. just said here, that you expect them to be home, and they can't even hug their parents, and they can't visit their older parents. I mean, it's
there was a lot of confusion all over the place.
Yes, and they want to walk out. They need the energy. And remember, the first curfew was from 6.
6 years. 6 is pretty early. 6 is very early, actually.
Oh, it's so early.
Yes, you can imagine from 4 to 6. It's a young person who sleeps. People don't wake up at 6. You know, they are online until 4. Then they sleep until 11. So at 6 in the evening, you're supposed to be. Please, this was stress at its best.
Yes.
You didn't need to ask if anyone is stressed. People were stressed. So, and that's why the mental health now became, actually even people who had never taken mental health issues seriously, now started realizing that we are actually suffering a catastrophe. And that's why now we are where we are. Now, what are the effects of this now? Like you've had asked me, from that background, relationships. You wanted to marry this girl, you wanted to have a wedding. Emmanuel?
Now you can't even have a wedding. They're not even allowed in the first place.
Okay, another one, try another one. Finances. You were paying 10,000, you had to train a job. Now you don't even have money. And what are young people doing now? You have 10,000. You owe Emmanuel, I owe Emmanuel 10,000. He's demanding. So I borrow 15,000, I pay him 10, and I remain with 5. And then tomorrow, Nina is asking for her 15. So I borrow 20.
And they have nothing.
Yes. So, but you give me the 15 with hope that I will refund. So I borrow 20, then I refund you 15.
It's a vicious cycle.
Thank you. And that's why you hear, when you pick the media, borrowing on the phone is at 2 billion. Actually, I hear the Fulisa. I hear the Fulisa group now is at 10 million. I understand they can even elect their own president, senator, MP. So and let's not forget, these are our children. Yeah, but for me, they are our children. Yes, I am. And you can imagine, ask yourself, what happens next with these 2 billion?
It
10
keeps
million
increasing.
Fulisa members. 10 million, not 10 people, 10 million. And that's why you now see what we are now getting into is young people getting in more and more entangled into debt.
Yes.
How do they come out? In fact, I've been saying that it is time we started now doing programs on talking to young people about the economics and managing the economics.
Yes.
And asking, what can you afford? What can you afford?
And there's peer pressure to live like everyone else.
I like that part. Because like now the Dr. is here, Emmanuel, and he takes a photo selfie with his tie and suit. And I don't have a tie and a suit.
And I want to be like Dr.
There you've said it. Yes. And you see that peer pressure and the media and the social media becomes part of the mental agony that people are struggling with. Because when Dr. here takes a photo with his VH, I'm like, I also need that. Remember, I don't even have a job in the first place. And even the job I have so many obligations to meet. And people are now getting more and more entangled.
Yes.
So the COVID, what I'm trying to say is that COVID came with it so many aspects that are entangled into it. So you look at COVID and you can't forget finance. You can't forget vaccines.
Yes.
And you can't forget, like, I like the way Dr. is really explaining about understanding why vaccine. Because at the same time, Dr. and I, we want to greet our parents, our grandparents.
Our children.
We want to be near
small
them.
Ones, yes.
But there's this monster called COVID that says, excuse me, put on a mask, keep your distance, fumigate,
Yes.
Sanitize.
And actually the fear is real. The fear he talks about is real, because if you just look at the numbers, what is reported, so far about 6,000 people in Kenya have died, are reported to have died of COVID, about 5,600, and over about 350,000 were reported actually have tested positive for COVID. Of course, most of these people who tested positive for COVID, most of them got better, healed, and have gone back to their normal lives. But the fear that he's talking about is real, because that 6,000, it could be you, it could be me. How do we prevent ourselves from being among the 6,000?
You've said have gone back, after they've healed, they've gone back to their normal lives. I don't know if it's a myth or a misconception or it's actually a fact that ukishapata COVID, your body will never be the same again. We've all had that.
Yes,
We've all had that.
Thank you, Nina, for that.
I had COVID.
You had COVID.
So
Okay.
I had COVID. My wife had COVID. I don't agree that life will not be back to normal.
Yes.
And Dr. can comment on it because he's the doctor, the immunologist. What people say is that there's a lot of COVID affects a bit of your memory, which is true. And I had COVID personally. Yeah, my wife had COVID. My wife was in ICU for 11 days. And when she came back, actually, she was a bit traumatized. And of course, we took her through all that process of getting back to normal, which is a
therapy and all
yes. Actually, I used to stay with my wife.
So actually, you've experienced the psychosocial.
Yeah, you just need to relax. You just need to relax. And she relaxed. What the truth is that it does affect a bit of the memory, but it doesn't mean that your life will never be back the same again.
This has me very curious because at some point now I'm starting to question myself. I'm starting to question myself, Doctor.
Thank you. Now, the truth of the matter is, COVID is still a very novel molecule, even though it's 2 years old. Now, probably this is the third. 2020, 2021, 2022 now.
We're getting to the third year.
But it's still a very novel molecule. It takes a lot of time for research to be gathered about any illness. So as at now, there is what I call the infodemic, the deluge of information. And if I remember what I was actually talking about earlier, they're called conspiracy movies.
Yes, conspiracy theories.
Yes, the theories. I used to watch a lot of that. So one of the things that in the infodemic, the misinformation and the disinformation, one of the things that came up is there has been a lot of misinformation. Some of it include suggestions that probably you would never be the same. The truth is, COVID for some people is a very serious illness, especially when it gets to, ideally it's supposed to be an upper respiratory tract infection, but when it gets to the lower respiratory system, causing what you would ideally call COVID pneumonia, you struggle to breathe. So when it gets to your lungs, when it gets to your lungs, you probably have what you could call fibrosing of the lungs. So such manifestations might probably live with you longer. However, if you just had a normal COVID infection, which didn't affect any other systems in your body, you are probably going to go back to normal, and you probably even forget you ever had COVID. Yes. So I would say, yes, it could change your life depending on the level of infection you had. However, it's also still, actually a majority of the people go back to their normal life, being who they are, especially if no other body systems were involved, no other body systems were affected by the COVID. Yes.
Nina, I like what Dr. is saying, because I wish we could be having people like Dr. saying what he's saying. He's saying something very significant, because from my research, me, I'm a counseling psychologist, so I only deal with issues to do with psychology. And I like what he's saying, because it's very significant. How is the body affected? Like, I noticed something like that you said. My wife was in ICU with about 11 colleagues, and 3 of them developed high blood pressure, or something diabetes, like that. My own colleague who had COVID, he was laughing at me, because when I had COVID, even my sugar was 5. I don't take sugar, by the way. So actually, I remember when as he was getting better, he looked for me, because he knew I had COVID. And yes, he told me now his greatest problem was he could no longer take sugar. Because he had actually developed diabetes after the COVID, and he no longer takes sugar, and he was so traumatized. And he was asking, I told him I've never taken sugar.
It's not the stigma.
Is it that you had some of these conditions and they were suppressed, and then COVID came and they amplified them, or what happened?
Exactly, yeah.
Yeah,
probably because I would say, so far, to the best of my knowledge, I don't have information that would actually prove a direct relationship between COVID and diabetes, but it's possible that probably some of these ailments, are actually undiagnosed.
They probably had them.
Yes, you probably have them before and they're undiagnosed.
COVID just amplifies it.
Yes, I'm not sure, like for you, Nina, I'm not sure the last time maybe you just went for a checkup, maybe your sugars, your blood, some of, they're very real things.
I'm still young.
Yes.
Yet to go.
Actually, those are some of it. We have a lot of undiagnosed conditions, just like mental illnesses.
Yes,
a lot of undiagnosed non-communicable diseases as we walk around. So it's possible that they could have had the
diabetes.
Yes, or probably they were borderline diabetic, but then afterwards, Yes.
It showed up.
It showed up. I have a friend the other day a young guy who went to hospital to seek, actually looking for replacement of their lenses. So the place I advised them to go, they were actually, one of the things they had to be tried. Their blood pressure was taken, and it's at that point that they discovered, they actually didn't go for a checkup. They actually went for a checkup of their eyes. But when because they are tried as they waited to see the eye doctor, it's at that point that he actually realized that my blood pressure is borderline high. Even after 3 measurements, even after they actually advised them after the appointment, they should probably go back, take another measurement, and it was still high, which probably means they've been walking around with some of these conditions. Yes, but back to COVID. COVID is actually, I would say we should take it with the seriousness it deserves, especially in the young people. It has really affected us in various ways, in very many ways. Work in a hospital, how they looked at you. Yes, they would think, utatuletea COVID. I've seen colleagues suffer from serious bouts of others pass on. I've seen colleagues, and including myself, have to adjust our schedules to work longer hours than we would otherwise work before. Yes, because now we had all these quarantine centers and isolation centers which needed more people. Of course, we all know that the government and even private hospitals didn't employ more people to cater specifically for COVID. The existing ones were the ones who actually redirected to offer their services. Yes. So that also brought in another aspect of a strain on the healthcare system. We at some point discovered, actually, for a country of our level, we had very few ICU beds. When at some point you had to really be connected to get an ICU bed if you had a COVID patient, especially in the courses of mid last year, when we had
it was at peak.
At peak, the second wave that was quite fatal. Yes. So the other thing about vaccines that I just remember now that I'm talking about this is vaccines help lessen the strain on our healthcare system. Because if, as young people, not just young people, actually I would use young people because young people, we are the majority. We're the majority, and probably, I was looking at statistics the other day, and I think we constitute over, 60% of the population. I'm not sure, but probably it would need a fact checker. So if people are vaccinated, which means that there will be less hospitalization, it means that the strain on the healthcare system is actually less. Yes. And you can see this actually using examples of developed countries such as America. America, a superpower, actually buckled under the pressure of COVID. Their healthcare system buckled under the pressure of COVID. The healthcare system could not meet the demand presented by COVID. All these things are actually made better with vaccination. Yes, people
make life easier.
They make life easier. They break the chains of transmission. Less people need hospitalization, and that has resulted into even better productivity. Because as we speak, I think right now, if you turned positive, if you had a positive COVID test, if you presented a positive COVID test to your employer, you'd only be given 3 days off. Unlike previously, when you away for 14 days. And some even went as far as I have another colleague who was away from work for almost 2 months. All that reduced productivity. All that reduced productivity. It actually had some of the effects that actually had a big hit on our economy. So vaccines have done so much in trying to
bring things back to
normal, and even if they never go back to normal,
they are much better,
more acceptable. We are now able to live we're now able to live with it, probably like any other disease. Yes.
And like you said about stigma, it's true. Even when we had COVID with my wife, people
yes.
would
Neighbors.
visit us.
Yes.
No one wanted anything to do with
people would
you.
point at you. You know, those ones had COVID. And I
Even
remember,
kids, I would know kids, and I was chasing wale watoto.
Actually,
Oh, yeah.
and it was. I remember even when after that, when I even spoke to my colleagues even at the university, they were very happy. In fact, that evening my phone was jammed because it's like everyone was so happy. I had COVID and I've never talked to anyone, and because no one wanted to talk about COVID, and I'm so happy Daktari is this good that I'm talking about COVID and it's not running away. I would meet people and I would tell them about COVID, and you see them running away and they excuse themselves, and the stigma it was so much that at one point people were feeling like no one wants to be near you, and that wasn't really necessary.
Yes,
because I like the way he puts it, that we need to understand this an illness like any other. Just like we've brought mental health to be an illness like any other.
Yes.
Malaria, and I wish also we push it the same thing that like you're saying about the young people. All of us have been young. Let us normalize the issues so that we can deal with them amicably.
Yes. Now, as we wind up, Daktari, I would like you to, give us a final remark. Also, as you tell us one thing or two things that you have 1 minute.
Okay.
Two or one thing that people can do to take care of themselves during this COVID, because it's not ended. It's like it's even getting back. What can we do to take good care of ourselves as a Daktari before this other Daktari tells us what we can do as a psychologist?
Okay. Okay. Thank you. 1 minute is a bit short, but it's still okay. The Ministry of Health has actually done very well in controlling the narrative. The best thing I think for us we could do is, because it's working alongside a task force, Kenitag, Kenya Immunization Technical Advisory Group, that actually generates guidelines based on the international trends. So the best thing we could do to take care of ourselves as young people is, one, follow some of these guidelines.
Regulations.
Yes, and the regulations that are being given to us. Right now, we are being told to vaccinate. We should vaccinate. Right now, we had initially laxed on the masks. There's a spike now, a sub variant of what we call the Omicron variant, that is causing spikes in COVID cases. If you've realized now, we have a lot of positive cases. Yes, so let's always be responsive. We've gone back to, let's maintain our, like now we're being told we should now go back to wearing masks in public spaces. Let's do that. We have to sanitize. Let's do that. If we are told to control the spaces we go to, let's do that. So my advice would be, we follow the regulations, especially through the Ministry of Health. They've had a very clear and a very good control of the narrative. Yes, and I think that is also what has really helped in bring down the stigma about the vaccine, what we call actually the vaccine hesitancy. Yes, because they've done well, the government alongside of course this has been led by healthcare workers, the doctors, the nurses, the government, the religious communities, education institutions now have put in a lot of effort in creating public awareness, and I think we're even here courtesy of a public awareness campaign to just make it clear out there that there are things we should still not lax on. Yes, and probably if we are told, like currently we are told, we've been told at some point, we were told, actually early this year we were told we needed to go for a booster shot, and a booster shot was supposed to be 6 months after the last vaccine.
Important is a booster shot?
Very important.
What's the difference between a booster shot and a vaccine?
The truth is, currently in Kenya there are about 5 vaccines. There's what we call AstraZeneca, there's Moderna, there's Pfizer, there's Sinopharm, and I think I'm losing the other one. So all this vaccine, it's the same shots that are used as boosters. However, there are guidelines on how they're supposed to be given. For instance, you'll be told, I personally got the AstraZeneca shot. So there was a time lapse of 12 weeks between the first shot and the second shot. So I got my second shot after 12 weeks. Then the booster came 6 months after the last, after the second shot. Yes. So the booster for me was Pfizer.
Yes.
Yes. So
Oh,
yes,
yeah. Okay,
yes.
now I understand.
So there's a way. There are guidelines on if you got this as your first vaccine and you got this as your second shot, you can actually get this specific one
As a booster
as
shot.
a booster shot.
Okay.
But the boosters are still the vaccines. Boosters are very important because the immune response elicited by vaccines wears down with time.
Oh,
Because vaccines basically elicit what we call antibodies. These are proteins in your body that are supposed to fight the invading
virus.
body,
Yes.
the virus. So these antibodies wear down with time. And that is why we need the boosters, and that is why probably there would be more vaccines for COVID coming up. Probably will be needed to take other
boosters.
or even other shots. So it's still okay, and as guided, we should follow it.
Yes.
And
Dr. Geoffrey.
thank you.
Asante sana. Thank you so much, Daktari. And my quick tip would be first is information. I like the way that Daktari has emphasized on information, especially for young people. Let's get the correct information. Let's be informed.
Yes.
Second, for young people, we need a lot of mentoring. Let us find out what we can do for ourselves and for others. And that, let us get organized in our lives. Despite the difficulties and what's going on, the more organized we are, the more our lives can be meaningful and purposeful, and we'll be able to make them as useful for ourselves
As
and for
possible.
others.
Wow,
you.
thank you so much, Daktari. We appreciate you giving us your knowledge. We appreciate you being here. I'd like to read your feedback as we wind up. The question of the day was, what mental self-care did you start during the COVID-19 pandemic? We have someone say, I exercise, like running was definitely the way to go. I used to run every day. Let me read one.
Actually, I do that myself. I started during the
COVID period.
Yes, I'm still an amateur, so I only do once a week.
At least you do it. At least you're still
I'm trying
doing
to
it.
build
Yes?
consistency before.
Before you completely forget.
Yes.
We also have Hawan Jerry. Good morning and evening. Workouts helped me a lot physically and mentally. You can keep bringing in your feedback. I will read them after the short break. We have the question of the day was, what mental self-care did you start during the COVID-19 pandemic? Thank you so much, Dr. Emmanuel. Thank you so much, Dr. Geoffrey. We'll be coming back after this short break.